What if one tiny bite can send two people into completely different medical stories? One person gets a bacterial infection that can move from a rash to the nerves, the heart, or the joints. Another ends up reacting to red meat hours after dinner because their immune system was changed by the bite itself. That is the first thing to understand about ticks. A tick bite is not one diagnosis. In the United States, different tick species carry different risks, and many tick-borne illnesses can begin with the same vague opening. Fever, aches, fatigue, maybe a rash, maybe not. So, if you remember only one framing idea from this whole video, make it this. The species matters, the region matters, and the symptoms do not always tell you the full story right away. Two ticks matter most for this episode. The black-legged tick, which is the main Lyme disease vector in the eastern and upper Midwestern United States. And the Lone Star tick, the aggressive human biter that is now widely distributed across the Northeast, South, and Midwest, and is tied to a very different set of problems, including alpha-gal syndrome, the so-called red meat allergy. Lyme disease still gets flattened into a cartoon version of itself. People picture one perfect bullseye rash, one easy diagnosis, one simple outcome. Real life is messier than that. Lyme disease is caused by Borrelia burgdorferi and is spread in the United States by black-legged ticks. Early illness can include fever, chills, fatigue, headache, muscle aches, joint pain, and a skin lesion called erythema migrans. CDC says that rash appears in about 70 to 80% of infected people. That means some people never see it, and even when it does show up, it does not always look like the textbook target on a white background that gets used in public awareness graphics. The other reason Lyme matters is that it is not just a rash story. If it is not recognized and treated, it can progress. People can develop facial palsy, meningitis-like neurologic symptoms, carditis, or later arthritis, especially in large joints like the knee. But this is also the part that needs balance. Most cases of Lyme disease can be treated successfully with antibiotics, especially when treatment starts early. So the smart message is not panic, it is recognition. Do not ignore the early window because you are waiting for the most dramatic version of the disease to appear. Now, we get to the tick that creates some of the most confusion online, the Lone Star tick. A lot of people hear about a rash after a Lone Star tick bite and assume that means southern Lyme disease, or just Lyme by another name. That is not what CDC says. Lone Star ticks have not been shown to transmit Borrelia burgdorferi, the bacterium that causes Lyme disease. But they can be followed by something called STARI, Southern Tick-Associated Rash Illness. STARI can look a lot like early Lyme. There may be a spreading rash, there may be fatigue, fever, or body aches. The problem is that the cause of STARI is still unknown, so this is one of those places where visual similarity outruns scientific certainty. And that matters, because Lone Star tick saliva can also irritate the bite site even without an infection. In other words, redness after a bite does not automatically tell you what story you are in. This is one reason tick medicine can be so frustrating to the public. Different tick species can create overlapping pictures, but they do not always point to the same pathogen, or even to a pathogen we have fully pinned down. The strangest tick story in this whole episode is not an infection at all. It is an allergy. Alpha-gal syndrome is a serious and sometimes life-threatening allergy that can develop after certain tick bites, most often associated in the United States with the Lone Star tick. The basic idea is that alpha-gal is a sugar molecule found in most mammals, but not in people. After a sensitizing tick bite, some people begin reacting to mammal-derived products, especially red meat, like beef, pork, or lamb. But the truly counterintuitive part is the timing. Unlike many food allergies, alpha-gal symptoms often do not hit immediately. CDC says they often show up 2 to 6 hours after exposure. That delay makes the condition easy to miss and easy to dismiss. People can develop hives, gastrointestinal symptoms, trouble breathing, or even anaphylaxis, and they may not connect the reaction to something they ate hours earlier. Diagnosis is not just one lab result. CDC says it depends on the symptom pattern, the timing, the exposure history, and blood testing for alpha-gal-specific IgE. A positive test by itself is not the whole diagnosis. And because alpha-gal can show up in more than just a steak dinner, some patients also have to think about dairy, gelatin, medications, or other products depending on how reactive they are. So what should you actually do after a tick bite? First, remove the tick correctly. CDC recommends using clean, fine-tipped tweezers, grasping the tick as close to the skin as possible, and pulling upward with steady, even pressure. Do not twist. Do not crush it with your fingers. Do not try folklore fixes like petroleum jelly, nail polish, or heat. Those are the kinds of tricks that make people feel proactive while wasting time. Second, clean the bite area and your hands. Third, pay attention to timing. Watch for rash, fever, unusual fatigue, joint pain, facial weakness, or reactions after eating mammal products, if the bite involved a Lone Star tick region or context. Prevention still matters more than any rescue move after the fact. Use EPA-registered repellents. Treat clothing and gear with permethrin. Stay out of brush and leaf litter when you can. Shower after being outdoors. Check your body and your pets. And one more practical point. Not every tick bite means you should take antibiotics. A single dose of doxycycline may help lower Lyme risk in certain situations. But this is not a take antibiotics after every bite rule. It is a specific clinical decision that depends on the bite, the area, and the timing. And now, the question that naturally follows all of this. If Lyme disease is so common, why are people still relying mostly on repellents, tweezers, and luck? As of April 9, 2026, there is no approved human Lyme vaccine available in the United States. That is the current reality. But there is real movement. On March 23, 2026, Pfizer and Valneva announced top-line Phase 3 results for their investigational Lyme vaccine candidate, VLA15, and said the vaccine showed more than 70% efficacy in the VALOR trial after a 4-dose schedule. The companies also said Pfizer plans regulatory submissions. That is meaningful progress. But it is not the same thing as an approved shot you can get at a pharmacy or a clinic right now. So if you are asking when it will be available and how to get it, the honest answer is this. Right now, you generally cannot get a human Lyme vaccine in ordinary clinical practice. Outside research settings, the prevention tools you can actually use today are still bite avoidance, prompt removal, symptom awareness, and early medical follow-up when something does not look right. Could that change? Possibly. The earliest plausible public availability would be sometime in 2027 or later if the submissions move forward and regulators agree. But that timing is an inference from current development status, not an announced launch date. So the takeaway is not wait for the shot. It is use the tools you already have while the vaccine question is still being decided. The useful way to think about ticks is not one bug, one disease. It is one bite, several possible stories, and a short window where correct action matters. Know the species if you can. Do not assume every rash means Lyme. Do not assume Lone Star tick bites are harmless. And do not assume a future vaccine solves the problem you have today. The practical answer is still the same. Prevent the bite, remove the tick properly, notice what happens next, and act early.